Assalamu alaikum and welcome to the program Ramadan for Better Health, and happy Ramadan to you and your families. We hope inshallah that you're being successful in your fasting so far this month. We do wish you well. May Allah accept all of our efforts. Today for the health topic that we're going to be discussing today has to do with our dental health. We're joined by a dentist. He's based here in Cairo, Egypt, to talk about many of the myths that are prevalent that we have about our dental health and our dental practices. Dr. Islam Talba, assalamu alaikum and welcome to the program.
Thank you.
All right, so we're talking about the myths that are prevalent in the urban culture about our dental health. What are some of these myths, and let's compare them or dismiss them or get rid of them with the facts.
Okay, so some people know wrong facts about teeth.
Okay.
For instance, some people think that white teeth are more healthier than dark teeth, which is not true. You can have someone with very white teeth, but it's full of cavities in unseen areas. Okay, and some other people with dark teeth have very healthy teeth. They brush every day, but it's their born color. They have natural dark teeth. Okay.
Now, what determines the color of our teeth? Is this genetics?
Yeah, it's genetics. Some people are born with white teeth, some others are born with very dark teeth, and it's out of their hands.
So I don't need to be shy about I don't have very white teeth. My teeth have a yellowish tinge to them. I don't need to be shy about that.
That's totally normal.
Okay. All right. So you're saying that the important thing is that we understand that whiteness does not equate healthiness.
Yeah, exactly.
Okay.
So you can have white teeth, but it's full of cavities in unseen areas. So that's not an indication for healthiness.
Tamam. All right. So what are some of these other myths? What about many people who have darker teeth may want to go through, there's all kinds of ways to whiten your teeth, different toothbrushes and toothpaste and other techniques. What do you have to say about these things?
Okay, so there's also a false fact about whitening teeth, that it's dangerous. It's not, but it has to be done at the dentist's office with a professional kit and a professional appliance that whitens the teeth to a limit, not excessively.
Yeah. Because
excessive whitening causes tooth sensitivity.
So there's a right and wrong way to do the whitening.
Yeah. And before the 90s, the gel that we used was acidic. Now it's not, it's pH neutral.
Okay.
So that's totally fine for the teeth, and it uses oxides to just whiten the enamel so that the light refracts more on the enamel.
Tamam. All right, so in the past, you're saying that it was true that whitening could be harmful.
Exactly.
But you're saying that there's been some innovations in technology, and now it's safer.
Yeah, exactly. Yeah. And now they use oxides instead of acids.
Okay. Now, what about on the market? We have all these things, these claims, they have these whitening properties in the toothpaste. What do you say about that?
It's not very effective. The only effective whitening is what you get at the dentist's office.
Tamam. Okay. All right. So these are two very good points. What other things can you talk about, these different myths that we have that are circulating in the urban culture?
Okay. Some people tend not to use sugar at all, thinking that the sugar is the cause of cavities and caries, which is not true. The sugar is used by bacteria to cause cavities.
This is curious because we have this conception that we need to avoid sugars, very sugary drinks, sugary foods, hard candy. You're saying that the problem is not the sugar itself.
Yeah, it's leaving the sugar in your mouth long enough for the bacteria to start doing the cavities.
Got it.
Yeah.
Okay.
So after you eat something sugary, you have to brush right away, and that's fine.
All right. So you're saying the important thing is, or the problem is, leaving the sugar on the teeth.
Yeah, not brushing.
Not brushing.
Yeah.
What about let's say you're traveling, you're at school, you're at work, you don't have your tools with you. Is rinsing, is that helpful?
Rinsing is somehow helpful, but it's not ideal to do just rinsing. You have to go with a toothbrush everywhere.
Okay. So rinsing would be about a half step.
Not maybe 30%.
30%.
Yeah.
Okay. A little more than a quarter step.
Yeah.
But you're saying that when we eat sugary things, the important thing is to brush with our toothbrushes and toothpaste.
Right away.
Right away.
Yeah.
Okay, so let's continue. We're dispelling these myths. What other myths circulate?
Another myth is using a lemon and sucking a lemon to whiten your teeth, which is not true, and it causes more harm than good.
It's a lemon that is highly acidic.
Yeah,
right?
it's highly acidic. It causes erosions to the teeth,
Uh-huh.
which is not good. Whitening, as I said, it has to be done with oxides, not acids. So when you suck a lemon, it causes erosions and attrition in the teeth, which is not something good.
What about if you dilute like you have a mixture of lemon juice and water? Is it still?
No, drinking a lemon juice is fine.
Mm-hmm.
Just drinking, but some people suck a lemon and squeeze it on the teeth and keep it for a long time.
So there's a myth that slicing a lemon
Yeah.
and sucking on a lemon wedge will whiten your teeth. You're saying no way.
No way. It's acidic and it causes more harm than good.
Okay, tamam. The problem with the lemon juice is the acid. Is that right?
Yeah, acid.
Okay.
Highly acidic.
There are other things like fizzy drinks, the colas that we drink. How does the lemon juice compare to the colas?
Lemon is highly acidic and more acidic than sodas, but both of them has to be consumed in a limit. You don't get to drink a lot of sodas or lemon juice. Both of them do harm,
Mm-hmm.
but sodas we have to go very, very, very minimal on them.
Mm-hmm. And so I imagine you would recommend the same thing, that after we drink a soda, that we should brush our teeth as well.
Or rinse.
Or rinse.
Yeah.
I've heard, doctor, that it's recommended for us to drink, if we choose to drink fizzy drinks, to use a straw. Is that helpful at all?
Somehow helpful because the soda goes to the stomach directly.
Uh-huh.
It doesn't stay on teeth.
So it doesn't, we reduce the time that we
Yeah.
bathe our teeth in this,
Yes,
this
exactly,
acid.
exactly.
Uh-huh. Tamam. All right. So we're saying that we should avoid these acids because they are corrosive.
Yeah, exactly.
To the
Corrosions.
teeth?
Yeah,
And you're saying that sugary things provide food for bacteria?
exactly. The
Uh-huh.
bacteria use sugar to start the acids that do the cavities.
Okay. So the cavities come from the work of these
Yeah,
bacteria
bacteria on sugar.
living on the sugar
Yeah.
that we eat, and we don't brush away.
Exactly.
Got it. All right. So let's continue. What other myths would you like to address today?
Okay. Some other people who start brushing
Mhm.
and the gums bleed.
Mm-hmm.
They stop brushing at all.
There's a photograph here of a lemon,
Yeah.
and so you're saying that people just take these lemons and slice them and then suck on it with the idea that it will whiten.
Yeah.
And again, just to repeat, you're saying that it's totally, it's harmful.
Yeah, it's harmful and no need for it at
Okay.
all.
What about lemon? This is a bit of a mix. We see a lot of products that use lemon flavoring, lemon flavored drinks, lemon flavored candy. Would the advice be all the same?
Yeah, but these have less concentrations of acid than a true lemon.
Mm-hmm. And the main thing with the candies is the sugar.
Sugar, and if it's lemon, so acid and sugar, it's both harmful.
What about other? Now, lemon is not the only acidic fruit or vegetable that we eat.
Yeah,
Can you
exactly.
talk about other?
Same goes for orange,
Okay.
apples, but eating an apple is actually good for your
Mhm.
teeth because it has a lot of fibers.
Okay.
So as they say, an apple a day keeps the dentists
doctor away.
Yeah, dentists away.
All right. So you're saying that this applies not only, we don't need to isolate and pick on the lemon, any citrus, grapefruits,
Yeah.
oranges.
You can eat them,
Mm-hmm.
but to a limit. As I said, they use the lemon, they don't eat the lemon, they keep squeezing a lemon on your teeth, which produces high acids. So eating a lemon or an apple is not harmful.
So I think we should just, I don't know, are you saying that the general thing, because there's so many things that we eat, the general practice is after we eat, would you say it's better to just at least wash and preferably to brush?
Yeah, what we prefer
Yeah.
is that you keep a toothbrush with you anywhere.
Hmm.
So after you eat anything, you have to brush right away, floss. If you floss, that's even better. But a brush would be more handy to keep with you and maybe brush 4 or 5 times a day, as you wish.
All right. All right. So you've opened up a number of things that are very important for us. We're almost at the break point. Before we take our break, you were talking about another myth regarding bleeding and the gums.
Some people, when they start brushing their teeth, it starts bleeding. So they stop brushing at all, which is not good. You have actually to brush more to stop that bleeding, because bleeding comes from an inflammation in the gums. So if you brush more, this inflammation will go away.
But doesn't that hurt the gums if you're...
Yeah, it's going to hurt for a few days, but you have to do it. Not just stop, because stopping would be more harmful than brushing with pain.
So if we brush and we see the blood coming, you're saying that the correct thing is to continue the brushing?
Yeah, not stop it, and maybe go see a dentist to do some cleaning, professional cleaning. That will help to stop the bleeding, but it's going to stay for a few days till the inflammation goes away.
What causes this bleeding when we brush?
Yeah, it's something called gingivitis.
Gingivitis.
Which is inflammation of the gums. This comes from accumulation of plaque or tartar, or whatever you call it, on the gums. So actually we have to brush it out to take it off so that the gums would regain its health.
I see. So a lack of proper care is causing the bleeding to begin with. All right, doctor, we'll take a short break right now and continue our discussion about dental health. Dr. Islam is dismissing a number of myths that we have. We'll continue the discussion after a short break.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
We all know that a person's iman increases and decreases, and the best way to increase your iman is through the Quran.
To contemplate, to reflect, to ponder over the verses of the Quran.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
In this program, we will listen to the Quran first, and that should soften our hearts. And then once we get to know the meanings and contemplate over these meanings, then we can change by the will of Allah subhanahu wa ta'ala.
ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا. ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا.
Join us this Ramadan for Quran Circle.
Assalamu alaikum and welcome back to the program Ramadan for Better Health. We're discussing various dental myths that circulate among us regarding our dental habits, our dental health. We're joined by Dr. Islam Talba. Before the break, Dr. Islam, you were talking about bleeding gums when we brush our teeth. You said when we see the blood, that we shouldn't be afraid and that we should continue brushing.
Yeah, exactly.
Right?
Some people stop the brushing. I recommend it's go brush more, because bleeding comes from something called gingivitis. Gingivitis is the inflammation of the gums. If we leave it, it's going to progress to something called periodontitis, which is inflammation of the surrounding structure of the tooth.
Okay.
This causes bone breakdown, and by time you're going to have loose teeth. So if you stop brushing when you see bleeding, it's going to end up having tooth that's loose, and you're going to lose the teeth.
And of course, prevention is always preferable.
Yeah, exactly.
And in order to prevent the bleeding gums, what is the best thing to do to stop the gums from bleeding in the first place?
I would say two things. Brushing 4 or 5 times daily, and flossing. Flossing is something it's not common.
Mm.
So flossing reaches areas where the brush cannot reach.
Yeah.
That's why you have to use the floss 3 or 4 times a day after every meal to get in between teeth and remove the plaque or the sticky food or anything.
So it's not something that we can just passively, we have to be very active to have
Yeah,
good dental
exactly.
health.
Yeah.
We have a picture here of a toothbrush and toothpaste.
Yeah.
And you're saying that some of the toothbrushes are made with, can you talk about some of the architecture, the structure of the toothbrush?
Yeah, okay. Some toothbrushes have 2 sides.
Mm-hmm.
One to brush the teeth
Mhm.
and one to brush the tongue.
So brushing the gum is important.
Tongue.
The tongue.
The tongue,
The
yeah.
tongue. Uh-huh.
Yeah, because people leave the tongue and they don't brush it.
Mhm.
Actually, new toothbrushes have a side specially for the tongue.
Uh-huh.
You flip the tooth
Yeah.
backwards
Mhm.
and use it on the tongue to remove the food debris and sticky food or anything.
Yeah, I've seen on the opposite side of the bristles, the
Yeah.
rough side.
Yeah,
This is
exactly.
for brushing the tongue.
For brushing the tongue.
And why is it important to brush the tongue?
To remove anything on the tongue. Maybe you have colors or something sticky on the tongue or debris.
So the tongue can actually catch food debris.
Yeah, exactly.
Mm-hmm. All right, so part of having a healthy mouth is brushing our tongue.
Yeah, exactly.
All right.
And some people think the toothpaste is more important than the toothbrush,
Mhm.
which is the other way around. Toothbrush, even if you have just water and toothbrush,
Mhm.
it's more important than getting a toothpaste on your finger, because the action of brushing is what gets the teeth clean, not the toothpaste.
I see. So all these fancy marketing schemes by the toothpaste companies, you're saying the important thing is the friction
Yeah,
with the
exactly.
brush
With
on
the brush.
teeth.
Even during Ramadan, if someone is fasting and he doesn't want to use the toothpaste,
Mhm.
he can just use the toothbrush with water and brush all his teeth, and that would be enough.
Mm. I want to go back to plaque. You said that the plaque was a buildup on the teeth. Can you talk about what plaque is? What is the actual material that the plaque is?
Okay, plaque comes from saliva.
Mm-hmm.
It's just like accumulation of salts found in the saliva in areas where we don't brush or there is no movement at all. So when it starts accumulating, by time it gets calcified from the saliva as well.
Mm.
That's why it comes hard, it becomes hard,
Mm-hmm.
and it starts sticking on teeth.
Mm-hmm. So we naturally produce
Yeah.
the plaque
Yeah, exactly.
And
if we don't brush.
if we don't brush.
Yeah.
And eventually a buildup of plaque can lead to what?
It's called calculus.
Calculus.
Yeah, calculus is the hard plaque.
Uh-huh.
It's like a rock.
Mm. And this cannot be moved by a toothbrush.
No, you have to go to the dentist to do the professional cleaning, or what we call scaling, to take it out.
Got it. All right, so we need to have a regular habit of removing the buildup, not only the buildup of plaque that naturally comes from our saliva, but also the food that we eat.
Yeah, exactly.
And you talked earlier about acidic foods, lemons and citrus fruits and vegetables, and sugary things.
Yeah.
Right? So we have every reason to be very regular brushers of our teeth.
Yeah, as I said, 4 or 5 times daily and maybe 3 times flossing. And you have to go to the dentist every 6 months for a normal checkup and just cleaning to see everything is fine.
All right, so you gave us some very good advice, doctor. If we are traveling or we happen to forget our toothbrush, you said what? That we don't need to worry about having the toothbrush.
Yeah, but you have to buy a toothbrush. It's more important than using a toothpaste on your finger.
Yeah, okay. So this is for a temporary,
Yeah, exactly. If you can get a toothbrush, you can use a toothpaste on your finger, but it's not what's important, the toothpaste. The toothbrush is more important than the toothpaste.
Got it. Okay. We have a telephone now, doctor. A caller, Dr. Hissam Tawakkul. Assalamu alaikum to Dr. Hissam. Welcome to the program.
Wa alaikum assalam wa rahmatullah. Thank you very much.
We are talking with the doctor here. He's a dentist, talking about our oral health. Can you talk to us? I understand that you're a pediatrician. Is that correct?
Yeah, correct.
can you talk to us about sometimes we have infections that are set up. What would you like to say about this when infections get set up?
Sure. I mean, this is really a very important and a very interesting topic. We face this issue a lot at homes when one of the family members is sick, and how to prevent this infection from spreading to other family members. And to really understand this, we have to understand first what kind of infections affect us. So most of the infections that affect us, either it is viruses or bacteria.
Mm-hmm.
And these organisms, they can be transmitted from one to another.
Mm-hmm.
And to really understand this transmission, there is something called the chain of spreading this infection. So there is a chain. The chain starts from the germ itself, whether it's a bacteria or virus, and then this goes to a person, which we call the host. That person becomes sick with this viruses or bacteria, and then he can transmit. There is something called the mode of transmission, that bacteria or viruses can be transmitted through many ways,
Mm-hmm.
either through like food or towels or toys or even our hands can
Mm-hmm.
be a mode of transmission to the other person. And through this host and through this mode of transmission, the sick person will transmit this virus or bacteria to the new person, and then that new person will be sick, and then the cycle will go on and on. So this is called the chain of spreading an infection, and actually to control this infection, you need to break this chain, and this will be the most effective way of preventing the spreading from one to another.
Mm-hmm. Yeah. All right. And this is very much in keeping with the discussion we're having with the dentist. We're talking about maintaining good oral health, and you're saying that another important part of being a healthy person in general is being careful about the things that we put in our mouths and the places that we buy our food from, and because they could be transmitters of different types of bacteria or other things that could lead to infections and sickness.
Sure. So, there are many ways that we can transmit organisms from one to another. And one of the ways is what we call droplet infection, meaning when we sneeze or we cough, we can transmit viruses or bacteria from a sick person to the other person. Also something called contact infection. Contact is when we touch things by hand. So, and there, as I said, we need to break the cycle of infection that will start with organism, host, mode of transmission, and then another person. You need to break this cycle at one point, and there are many ways actually to break the cycle. But the most effective way that is known to prevent spreading of infection from one to another is a very simple thing that we almost taking like for granted, is hand washing.
Hand washing.
So hand washing is considered the most effective way. Even if the respiratory thing, the viruses that we think it just spread by sneezing and coughing, we're proving that they spread by also hand contact. So hand washing is very important and the most effective way actually to spread infection in hospital and in the household. So hand washing has also, there is techniques and there is times. So the recommendation is to wash the hand at least for 20 seconds.
20 seconds.
And it has to be thoroughly, 20 seconds. And there is technique how to rinse with your hand first and then put the soap, and then you have to wash all the hands, even between the fingers, to effectively eradicate any bacteria.
Dr. Hassam, I want to ask you about the soap that we use. Is it important? Does it matter? There are all kinds of soaps on the market. Some have these antibacterial properties. Is it important about the type of soap that we use when we wash our hands?
Yes, actually, there are certain soaps on the market is known to have antibacterial effect. And I think this soaps are recommended more than the regular soaps. So you look at the soaps that are available that's known to really eradicate most of the bacteria on the hand. I think this will be a more effective way than the regular sauce.
Mm. And could you talk about the temperature of the water? Does it need to be warm, or is cold water okay?
No, it doesn't really matter the temperature of the water, as long as you are sticking with the timing and the quality of salt that I mentioned. Also, you know, when to wash the hand is very important. You know, so like at home, when you first enter the house, you're coming from out, you may be recommended to wash your hands so you won't transmit the outside bacteria to the to inside the house. Also, before preparing any food, or before eating, before feeding a child, after feeding the child, and this is very important, as I said, not to spread the infection to the child. So you have to wash your hands before and after. If you assist a child in going to the bathroom, that would be another time also to wash hands or change diaper.
Okay.
Or after coughing or sneezing. And now the WHO is recommending what a campaign called sneeze to sleeve. So instead of you sneezing in a hand or sneezing on a towel, it's better to sneeze on the sleeve of the shirt, because the fabric, the bacteria will die on it, or the virus will die on it.
Dr. Hassam,
transmitting this to another person.
Dr. Sam, I'm sorry to interrupt you. We're almost out of time. Thank you so much for calling and talking to us about how to maintain our health, the important role that hand washing plays in maintaining our health. Thank you so much. This is Dr. Hassam Tawakkol. He's a pediatrician here in Cairo, Egypt. Salam alaikum to you, doctor. So this is something that is very important. He's talking about the importance of washing our hands, not putting things in our mouths. What about the toothbrush itself? Do we need to pre-clean the toothbrush, or?
Yeah, or keep it in somewhere clean.
Okay.
You have a place to keep your toothbrush, or a case to keep it in.
A case, yeah.
Yeah.
And what about rinsing the toothbrush?
Yeah, you have to do that before
you start.
Yeah.
And with warm water or hot water?
Any water.
Any water.
Yeah.
Tamam. So we're talking about the health, the hygiene in our hands, and the hygiene in our teeth. Now, sometimes people, is it true that some people can develop infections in the teeth or in the gums, or how does that work? What sets that up?
It's exactly what we talked about earlier. It's the gingivitis, which is an infection or inflammation in the gums.
So gingivitis is actually an infection?
Yeah, infection and inflammation.
Uh-huh.
Same goes for cavities. Cavities is a kind of infection because it's caused by bacteria.
I see. And of course, you're saying that prevention and just having a habit. This is the thing that the lasting thing that I get from you. Just reinforcing the need to have a habit of brushing.
And flossing.
And flossing.
Yeah.
Yes. All right. Well, thank you so much, doctor, for joining us to talk about the different myths that we have. This is Dr. Islam Tolba. He's a dentist here in Cairo, Egypt, dispelling and addressing the different myths that we have about our dental practices. We appreciate him joining us. Inshallah, we'll come back with more health topics to discuss in depth. Assalamu alaikum wa rahmatullahi wa barakatuh. Oh.